Hi, this is Dr. Sudarshan Ray, bringing to you once again a series of videos aimed at managing various health disturbances during this COVID-19 lockdown period. Now, over here today, we are going to discuss the various high-risk factors which actually lead to relapse in these drinking habits. Okay. Now, relapse is actually a return to the behavior of taking prodigious quantities of alcohol after, say, a few months or a series of abstinence periods. Now, after series of abstinence periods, basically, a person uh, can enter into a relapse. It is a very normal phenomena, though it's not a desirable phenomenon, not at all, but it's a very normal phenomenon that they return to their old drinking habits or smoking habits or chewing tobacco habits or taking uh, drugs. And this abstinence period is usually it occurs with the help of the anti-craving agents which we give so that the person can stave off the craving feelings for taking alcohol and other substance of intoxication, other chemicals, basically the other chemicals which basically modulate the behavior of the receptors, and that give rise to this addiction uh, habits. Okay, now how we will know that, how will a patient understand that the high risk behavior? Okay, the high risk behavior, you can actually you can phrase it into a short mnemonic. We call it HALT, HALT, HALT. Now HALT H stands for hungry, A stands for angry, L stands for laziness or boredom, and T stands for tiredness. Okay, now when a person is very much hungry, he may sometimes feels like taking alcohol or the addictive substances to stave off the hunger. Okay, now in many cases you see even in street urchins who basically to stave off hunger, they actually steal this glue or the petrol from the roadside these two-wheelers, and they sniff the glue to ward off the pangs of hunger. That is one aspect of in taking this intoxicating substances and inhaling them to order to stave off hunger. Another is hunger by itself. Even if a person is well to do, in order to stave off the feelings of hunger, or when he feels hungry, he takes this intoxicating substances like alcohol. Okay, then is that the question of the mood alterations, the getting angry. A person gets angry, and in order to stave off the anger, in order to calm his mind, he resorts to drinking or taking the intoxicating substances. Okay, now a person, then comes L, the L of halt. The person may feel very much lazy, and when a person feels lazy or feels bored, he doesn't wish to do any sort of work, a person can resort to taking this abusive substances, okay, in order to stop feeling bored, or because of his laziness he doesn't wish to do something, and he just wishes to take alcohol so that he doesn't feel bored anymore. His laziness actually makes him take it. Okay, a person may also feel very much tired, and at the end of a long hard day or anything, if a person feels tired, if physically or mentally tired, then a person basically can resort to drinking or taking intoxicating substances, so that basically his tiredness vanishes. Okay, so that is one way, perhaps it's a erroneous way of thinking, but that's how people do it. People who are into substance abuse chemicals, which basically alter his feelings instantaneously, and basically this is what uh, this is what a person actually uh, feels that taking these intoxicating substances will make him feel less tired. Okay, now craving is there, and obviously craving uh, has to be managed too. I mean, we are talking about this craving management only. Okay, and what do we do in craving management? Now, the best thing is that when you wish to have a drink can actually mean hard drink or a soft drinks. Then you can actually go and drink any soft drinks, or best is that you drink plain water. That plain water basically is a sort of drink also. Obviously it is harmless, and that will help you stave off the immediate need for drinking alcohol. Okay, then another thing which you can do is that uh, the person can actually take a deep breath. Okay, deep breath means what you inhale for the double amount of time you exhale. Suppose you inhale 1 2 3 4, then you exhale 1 2 3 4 5 6 7 8. Okay, you can actually take the deep breath through your nose and counting, and the number you count, the is same the double the number you exhale while exhaling from the mouth. So that is another way. If you do it repeatedly, basically it helps you uh, stave off the immediate craving of um, having a drink. Then what you can do is that you can delay you can delay. Okay, you feel like having a drink, and then you feel that okay, I'll have a drink a bit later. You convince your mind that okay, I'll have a drink, but I'll have it a bit later. Maybe you have a drinking pang at 4 p.m. You say that okay, let me delay. I'll take it at 6 after I'll do something else. Okay, you can actually discuss this craving, this alcohol craving, or the craving for other intoxicating substances with friends and peers who are nearby, with family members. And this discussion also takes up the time. It takes up the time, and it wards off the immediate pangs these immediate pangs, that is the cravings of having a drink. You can divert your mind. I mean, you go and indulge in any other activities. Okay, any other activities, you divert your mind, and any hobby, any TV serials, anything, you go out, you sing a song, and the idea is, you stop the craving for that moment, and once you get into the groove of the thing or the action with which you are distracting yourself or diverting your mind, basically after some time, you see, once you complete that activity, the singing or reading a novel, or just going out, say playing football or whatever it is, or running, and after that you see that immediate craving, it goes away, no? And when that immediate craving goes away, basically you feel that after some time you do not feel that urge, that craving to have uh, alcoholic drinks or intoxicating substances anymore. So these are the very simple techniques with which you can identify the high risk behaviors for which will make you drink and or take the abusive substances, drugs or otherwise, or nicotine. And then I've told you the simple uh, um, management mechanism, which are very very easy to follow. You obviously, it requires some practice, some discipline to inculcate into your habit. Whenever you see these high risk behaviors, this management, craving management, immediately will kick into action once you habituate yourself with this. Okay, hope you liking my series of videos on YouTube. If you do like, do actually visit my page on Facebook, Dr. Sudarshan Reshan Sharma, at the rate of Dr. Sudarshan Mental Health, and also visit my channel on YouTube, like, comment, and subscribe. Till the next video, thank you. Bye.